Hello, it's Dr. Minniear-Corrons with Mercy Clinic Primary Care located behind the hospital, here today for our weekly Wednesday wellness talk. Today I'm actually going to talk about wellness exams in general, and this is because based on my experience, I've found that people are pretty hesitant and sometimes, frankly, unwilling to go to their physician's office for a wellness exam because they don't see the benefit in having a wellness exam. And this is not surprising in a society where we are conditioned to pay for a service. So if you feel like a service is not being provided, you don't want to pay for that service. And many times, even if it's not the cost of it, you don't see, it seems like a waste of time to be going to the physician's office for no reason. But today I want to tell you why a wellness exam is very important, and having a relationship with your primary care physician is important for your long-term health goals. The healthcare model has always been reactive. You go to the doctor when you have a problem. In some cases, that makes sense. Some things cannot be prevented. You get a rash, you get a cold, you get the flu, things come up that you need to be seen by your physician, and so you go to be seen for that acute problem. However, there are chronic diseases that we wait many times until that disease process happens to go and be seen, when really all along we could have been doing things to prevent that disease from happening. Things like diabetes and chronic kidney disease and high blood pressure and high cholesterol. These diseases are lifelong, that you don't go to the doctor and get treatment and it go away. We just have to constantly keep treating it so that you don't get the consequences or the damage that occurs by having these diseases that are uncontrolled. So if you come to the doctor before these disease processes actually happen, we can be doing things to try and prevent you from crossing over into the disease state. If you wait until you start feeling bad, in some situations like with diabetes, when you start becoming symptomatic, many times it's too late. You've already entered that disease state and we've missed that critical window for prevention. So in a wellness exam, what happens? A wellness exam is very specific for your age and gender. For everyone, we do review vital signs at the very beginning. So looking at blood pressure and heart rate, and any derangements in these values can lead us to high blood pressure, or if you're having a heart rate issue, we can start looking for reasons for that. We discuss screening tests that are pertinent to you. Many times these are gender and age specific. So it kind of depends on where you are in your life, that those particular screening exams will be talked to you and relevant to you during that visit. We get basic labs to monitor many of the things I mentioned already. So looking at kidney function, your liver function, your electrolytes, that sort of thing, blood sugar. It gives us an idea, and as long as they're normal, we just continue to monitor them, and we can identify readily when there's been a derangement or something has changed in those values if you've been coming on an annual basis. You also get a thorough physical exam, which is important for everybody. And also at the end of this, if you have concerns, this is a great opportunity for you to bring those concerns to your physician's attention. Through these office visits, you develop a relationship with your physician, which is important. They get to know you when you're well, so that when you're not well, they do know the difference. And you just get to know them on a personal level, to where when you do come in for an actual problem, you feel more comfortable discussing those things with them, and it's not like meeting someone for the first time. A relationship with your PCP is an important relationship to cultivate. So if you've not had a wellness exam yet this year, and considering the pandemic, that's not uncommon and it's completely understandable. But if you haven't, now is a great time to get reconnected with your primary care physician. If you don't have a primary care physician, now is an even better time to get one and get established with them and start getting some basic stuff accomplished for prevention and your health. Remember, prevention is always better than having to treat something for the rest of your life. Quality of life is improved if we can keep you from getting a disease process. Thank you for your time. Next week, we'll be talking about nutrition, so stay tuned for that talk. Thank you.